What's up, everybody? Nice and locked in here. Hump day. Very good, very good. All right. Good evening and a hearty welcome to all the curious minds joining us tonight on the Know Your Pharmacist Livestream. I'm your host, Dr. Joaquin Acosta, CEO of Pharmtrue, here to steer tonight's expedition into the intriguing landscapes of the pharmacy practice and health advocacy. Guys, today our voyage unveils the narrative of retail pharmacy and industry, once bustling with activity, now facing the winds of change. The closure of local pharmacies not only alters the skyline, but also the lives intertwined with it. A change, though remote, echoes through the corridors of communities far and wide. So, is retail pharmacy dying? As we dissect the strands of transformation, we'll unroll insights from a recent CNN report and delve into a discerning discussion featuring a YouTube reflection by pharmacist Paul Tran on the future facets of retail pharmacy, an interesting predictor from 2020. After that, we're going to transition from discussion to discernment as we explore a study from JAMA International Medicine, shedding light on pharmacy closures across the United States and the ripple effects of these closures on our communities. Cool, guys. So our voyage does not stop there. Venturing into the herbal realms, we unveil the latest episode of the Full Spectrum podcast, where we walk the line between tradition and modernity, discussing the cannabis and the community. Guys, I had my white coat off a little earlier today, and we did it a little differently. It was going to be a fun one to talk about tonight. Also, we're going to cast the spotlight on the strength of community with the Oregon Mountain Boys basketball second annual cornhole tournament, a blend of competition, camaraderie, and community engagement, guys. And lastly, in our Men's Health Minute, we explore a unique initiative from the United Kingdom where barbershops became havens of support for men's mental health during the COVID-19 pandemic. Very interesting, right? Cool, guys. So again, we are not just hosts and viewers tonight. We are collaborators on a mission to foster awareness, ignite conversations, and fuel the desire for knowledge and community engagement. All right, guys. So our journey tonight, supported by our esteemed sponsors. If you already know, but you don't know, check them out. Pharmtrue, High Horse, the Tricom Alliance, and Vado Speedway Park. Their support not only fuels this platform, but reinforces our shared vision of empowering communities with knowledge and resources, guys. So thank you very much. Let's get ready to set sail into tonight's discourse. And as we do so, I truly invite you guys to engage, question, and share your thoughts as we navigate through the realms of pharmacy, wellness, and community. Your engagement is the beacon that guides this voyage, guys. So welcome to the Know Your Pharmacist Livestream. Let's embark on this enlightening journey together. Starting this thing up on our Pharmacist Frontline, is retail pharmacy dying? A good question, worth discerning, guys, for sure. Well, I'm going to show you exactly why that's the case. Again, Rite Aid is going through that bankruptcy in response to the opioid crisis and the lawsuits that have been going down, guys. Sharing with you here on the screen, Rite Aid's bankruptcy plan stirs worries of new pharmacy deserts. Well, as someone who is from the desert and as someone who also, understands rural pharmacy, I have some commentary, on exactly what that means to me. So cool, Rite Aid's bankruptcy plan stirs worries of the new pharmacy deserts. In a rural state, New Mexico, that we are in, we deal with pharmacy deserts and what that really means. So again, guys, that those of us who are in the cities, granted, we have better pharmacy access, but is the access even proportionately correct, right? Big problem. Other problems, right, include being so rural that your access to healthcare is absolutely shattered, and a pharmacy, maybe if you are close enough, pharmacies may be, of perhaps the top level of healthcare that you can get in a rural community. So you got to keep that in mind, guys. I mean, pharmacies are very critical, and talking about this over here, and like I said, we're talking about CVS, Walgreens, and Rite Aid closing thousands of stores, and here's why. I'm going to share this little clip from CNN just so you can kind of show you guys the overall outlook on this one here. I think it's important to kind of delve into.
Get help reaching your goals with JP
Get through this,
Morgan
Dad.
Wealth Plan,
Appreciate
the
you guys
digital
on
money
that.
coach in the Chase mobile app. Use it to set and track your goals, big and small, and see how changes you make today could help put them within reach. From your first big move to retiring poolside and the other goals along the way, Wealth Plan can help.
Couple more seconds of some JP Morgan shout outs right now.
Now, in 2022, the last year we have full stats for.
No. We are on the, of course, we are on the weird video there. Target's closing 9 stores due to organized retail crime, smash and grabs. This is not where we're at. We actually clicked the wrong one here. So excuse me, I'm just going to go and cancel out of this. But either way, we'll jump into the study next and into why, drugstore chains truly across the United States are closing. Look at the numbers that are expected to close for Rite Aid. 400 to 500 of its approximately 2,200 stores. They're filing bankruptcy to get that, speed up the pace there on exactly closing the crappy stores. And by crappy stores, they mean low and underperforming stores. What do low and underperforming stores mean? Maybe in a bad location, maybe high competition, mix of different types of clientele and insurances and stuff within the state laws and regulations, so on and so forth, could cause a mix of problems there, especially when you're trying to do it at the mass scale of 2,200 stores. So again, Rite Aid taking that hit to try to recoup some of that $3.3 billion debt load, going to close 400 to 500 of its stores, but they are not the only one. And that's the interesting thing to talk about, because we're talking, is this the demise of retail pharmacy? I think it's worth pardoning, but where there is struggle, there is opportunity. And that's where I think the change of what's, the future of the drug business and the pharmacy world is going to change a little bit. But again, looking at the long-term struggles there and the other different parts of the profit sectors for, retail pharmacies, like, drugstores front end, where snacks, household staples, even alcohol licenses can bolster and really, really help maintain a lot of those sales and a lot of that extra, foot traffic that's in there, and really maximize all of it, right? By helping everybody spend all their money in one place, which as a drugstore, you want to try to recoup all of that. But again, how are you getting beat? Well, competition like Amazon, big box stores, with pharmacies like Walmart or, Las Cruces, the Dollar Generals in the areas. You can find a Dollar General in all the rural communities. And again, it's always, it's going to be cheaper than Walgreens or CVS 10 out of 10 times. So minus the fact that they don't sell alcohol, some of the things that Walgreens and CVS were making a lot of their margins on, even Rite Aid, are affected by, competition. And I think that's a healthy thing. In Darwinism, right, we expect the strong to survive. Again, in the strong store surviving in these big companies where they could be closing 25% of their workforce or more, that's a different story, because yes, it's going to hold up communities, but the ones that are closing, guys, we're talking about, what are we talking about? Pharmacy deserts. Looking at pharmacy deserts, independent pharmacy, in fact, has been dying. From 1980 to 2022, nearly 50% of independent pharmacies, decreased. When I started my first one, all I ever was told was all the reasons not to do it, right? How much it's cost to get into, how hard it is when it comes to regulation, how long it takes to get the reimbursements and this, that, and the other. Guys, yes, fear mongering, it's a big thing. If I was big pharma too, I would say the same thing, so that, we don't get outbeat by the little guy, right? And, the little guy does still have power, because the little guy is the guy that's in the community, that understands what's going on, that takes care of his patients, right? Not that unfortunately has to get stomped on a hamster wheel sometimes to just be able to make a salary, to make a living, to make a wage, and not live a very high quality life. Not saying that's every pharmacist in a retail setting that's corporate, but again, these guys, as we have been alluding to in, National Pharmacy Month, so on and so forth, the Walgreens walkouts, Operation Spotlight, and everything going on with that, the pharmacy industry has really, really somehow backfired on some of the, the people that are actually participating in and building it up, aka the employees, the pharmacists, and the pharmacy techs. And that's where you do see, the walkouts, things like that. that have been really, really at the forefront of media and everything, national news in the last month or so. So what we're going to get into, though, is the interesting impact of these closures. So CVS, the largest U.S. chain, closed 244 stores between 2018 and 2020. In 2021, it announced plans to close 900 stores by 2024. Walgreens said in 2019 it would close 200 stores, and in June announced an additional 150 stores. So CVS closing up that 900 stores, Rite Aid recouping $3.3 billion by closing, 500 stores, 400 to 500, and then Walgreens promising a 350 store closure. Well, we're going to get into this study here by JAMA. Look who's affected by this. Of course, it always comes down to a socioeconomic impact. Roughly 1 out of every 8 pharmacies closed between 2009 and 2015, which disproportionately affected independent pharmacies and low-income neighborhoods, according to a study published in the American Journal of Medical Association. Study found the pharmacies at greatest risk for closures are those with a large customer base on public insurance, which have lower reimbursement rates than private plans, as well as independent pharmacies. So I can absolutely attest to that. Medicaid is terrible, right, in terms of reimbursements to the pharmacies. And again, because your big Medicaid payers are CVS and Walgreens and in some other version of an entity that's contracted out by the states to funnel out mainly people to all of their commercial insurance plans, and their Medicaid plans already know they are not going to favor the independent, right? They are not going to give that money away out in any other way that they possibly can. So they don't want to leak any money so that, their CEO, who's the highest paid CEO in America for a long time, could, have more yacht trips and things like that. So, I definitely think that's ridiculous, but you see who gets affected. So the pharmacies are chasing the dollars. That's how this works. Of course, if you want to make money, you have to chase good money, not bad money. And bad money is public insurance, right? Medicaid. Medicaid is really, really bad money. Oftentimes you lose money on prescriptions, especially brand name prescriptions that sometimes people may need. And, doctors and providers have such a difficult time trying to navigate that. And, that's where independent pharmacies really have dwindled down, because having to surf that, it's like truly trying to do, a double black diamond on a mountain, on a ski mountain, right? The hardest, possibly most vertically challenged you can get, with trees everywhere looking to take you out, but could be, if you do it right, the most rewarding full send experience you could ever have, right? And that's coming from someone who's done it successfully twice, going to do it again a third time. So, retail pharmacy, guys, is not dying, but what you're seeing here is them chasing, the good dollars and leaving the bad dollars, but the bad dollars actually equal people, and people are the ones who are suffering. And, the socioeconomic counties, such as Black and Latino neighborhoods, who are, suffering from pharmacies closing there, also have the least amount of healthcare access, also pushed, to the other crappier brinks of human capacity there, right? With the least probably amount of, support. And you can really argue that in many ways. Again, America is a free country. It's a great place, the greatest country on earth. Not to demean that by any ways, but where you look at a situation of, where does that get reappropriated in terms of healthcare? The good keep getting better. Obviously, your senior communities, such as Medicare, not Medicaid, right, are going to reimburse really, really well. So those who have chronic diseases that are not well, controlled, such as diabetes or cancer or hepatitis or, mental health, all kinds of mental health, instabilities there. Those are the high profit margin drugs. Those are the high profit margin medications, the high profit margin chronic disease states. So, who is getting treated? All those people are going to get the best treatment, and everything, so on and so forth, cascades. And that's just something that I've seen. The JAMA study that we'll talk about later doesn't exactly, talk on all those trends, but I think it's a very important thing here as you really do look at the healthcare community. And Marcy, thank you for asking, will you be opening a pharmacy anytime soon? Looking to be back in action there downtown at our 227 location, probably about by May. So as soon as our, beautiful baby Mesilla Valley Pharmacy spreads its wings, I will be back down doing my thing downtown in Las Cruces, how I've already done very successfully before, right back in my favorite place on earth. And yes, I will be doing it. It'll come in no time. So thank you for asking. Anyways, guys, moving on to tech talk here, talking about the future of retail pharmacy and what it became and why, some of these things, big pharma is saying, and I think it's just an interesting take here from another pharmacist. And this is back in 2020, July 12th, 2020, the retail pharmacy is dead. And this is why. And I really appreciate his take here because he was hitting it on.
Talk about the new developments for pharmacy technicians and their expanded role and how this will affect pharmacists in the long run. There are 3 pharmacy technician expanded roles that I want to talk about in this video, but before we do that, hit the like button for me and let's get started. Number 1, pharmacy technicians will be allowed to administer medications or devices under the supervision of a pharmacist. Basically, this means that pharmacy technicians will be allowed to prepare and administer vaccines to patients. Currently, vaccines are a big burden on pharmacists. I mean, they are a big moneymaker for the retail business, but it takes a lot of time out of the pharmacist's day. This is especially true with the upcoming flu season and the Rona situation, especially if we have a new vaccine for that. There'll be unprecedented demand for this vaccine. Having pharmacy technicians do this will definitely decrease the workload on pharmacists and improve the efficiency of the pharmacy. However, I do see this as taking another job duty away from pharmacists, thus requiring less pharmacists overall. So I found this article on Pharmacy Technician Certification Board, and they are collaborating with the American Pharmacists Association to develop an immunization credential program for pharmacy techs. Basically, in this article, it talks about a new credential and program to train technicians to immunize. Then if you look here, pharmacy technicians are currently authorized to immunize in several states, including Idaho, Rhode Island, and Utah. And other states are considering regulatory and policy changes to allow immunization by technicians. So with this information, I decided to go to my state board, Department of Health, to see what they were thinking. Looking here at the Washington State Department of Health, I found that our board has already been working on this as well. It is called the Ancillary Utilization Plans and Pharmacy Technician Administration. Basically, the summary here says that pharmacy technicians may provide administration of medications or devices under the supervision of a pharmacist, and if the Pharmacy Quality Assurance Commission has authorized the pharmacy technician to administer medication by approving an ancillary utilization plan. Alright, so now you see that most likely in the future, pharmacists' role in immunization will decrease significantly or go away completely and be done by pharmacy techs. Alright, let's go to number 2. Pharmacy technicians can now take new prescriptions on the phone, transfer existing prescriptions, or take in new prescriptions as a transfer. So if you take a look here, this is actually happening in Texas right now, where Governor Greg Abbott has actually temporarily waived certain regulations requirements to increase the job capacities of pharmacy technicians and pharmacy interns. Even though in this article it says that it is temporary, generally when these temporary pilot programs go into effect and they turn out good, it worked out well, they stay permanent. And if it goes well, other states will follow suit and implement the same type of regulations. And I see this kind of as a bad thing for pharmacists for job hours and pharmacists' jobs. Even though they're not really clinical decision making and it will decrease the workload of pharmacists, that means there's just less work for pharmacists. All right, let's move on to the last one. Number 3, pharmacy technicians can now prescribe naloxone in Idaho. So it looks like the main objective of having pharmacy technicians prescribe naloxone is to expand care availability, especially to rural areas. I see the reasoning behind this, but it's just another blow to pharmacists and their job duties. So in the article here, you see under a new state law that became active on Monday, 8 Albertson pharmacy technicians in the Boise area are the first to be specially trained to prescribe this medication, according to the company. It just doesn't make sense to me why we're using pharmacy technicians to prescribe naloxone when we have a surplus of pharmacists. Pharmacists have been trying to expand their clinical roles for many years and to prescribe, and so this doesn't make any sense to me. All right, let's summarize. So there's a lot of new developments and expanding the role of pharmacy technicians, and in the end, this is going to take away a lot of job duties from the pharmacists. Granted, some of them are non-clinical, but some of them are clinical, such as prescribing naloxone and, in a sense, immunization. So some may argue that, yeah, it's a good thing because now we're doing more clinical work and we have more time to do more clinical work, and we're doing non-clinical work, which is passed on to the pharmacy technician. Yes, that's true. However, that means less pharmacists are needed to run a pharmacy, and thus decrease in hours and affecting the job market even more. Now, if I were to make a prediction on the pharmacist market, and especially the retail pharmacist market, I picture a retail pharmacy ran by purely technicians and no need for a pharmacist to be on site, to be honest. Likely they can just work remotely from home or a centralized office in some shape or form. They'll just have to log in remotely and verify orders and do clinical reviews on all the orders across the state. There's no need for a pharmacist to be on site. You're not doing immunizations, you're not doing transfers or anything like that. And if you need to counsel, all you have to do is do a video chat or a phone call. Now, if you don't believe this is possible, think about this. What about mail order pharmacies? Those are closed from the public, and pharmacists there verify orders, check the orders, mail them off to the patient's home. There's no counseling, so how is this any different? And unfortunately, this will dramatically decrease the need for pharmacists and will decrease the pharmacist jobs, especially in the retail sector. Well, I hope you found this video interesting. Hit that like button for me. It really helps me out.
Anyways, shout out to Dr. Paul there, taking, a lot of those predictions from 2020. I like what he's saying because, talking about where pharmacy was going at the time, it was right at the beginning of COVID. All of that, really starts to take a new place because now we're in 2023. The pharmacy walkouts are currently happening. You're talking about pharmacy deserts with the big opioid lawsuits, billion-dollar lawsuits going around and everything like that. It becomes, a very different landscape for the future of pharmacy and the future of retail. But again, I think it's all very promising. I think a lot of those predictions were accurate to watch some of the dwindling die there. But again, the duties of the pharmacist right now are still, completely overloaded, and that's why the walkouts are happening. So things like, getting pharmacy technicians available to do, vaccinations is absolutely a great thing to help, take some of the tasks there. And if you could get to a more of a, pharmacy technician run pharmacy, eliminating the pharmacist from some of those non-clinical aspects that could be, hard checked a little bit better with better systems and better regulation. I mean, it really doesn't take away the use from a pharmacist, guys. I really hope you can see that. I mean, shoot, I go live as a pharmacist every single day on the weekdays, and I hope you guys get some value out of that. Hope it's worth my time. I know it is. So exactly, you got to be available for your people. And that's what that main job of a pharmacist is, right? It's, yes, you keep people safe, but you got to talk to people. You got to understand people. And you got to be there for your community. That is ultimately what a community pharmacy should be. Your pharmacist shouldn't be buried behind a computer and a freaking mound of prescriptions, not ever able to talk to you, and so stressed out and so fight or flight all the time that they can't even move. That's BS. And that's what's wrong with the industry. And that's what will change. That's where there is opportunity in the pharmacy world, for sure. And, hopefully we find better ways to obviously make money off of that too, because again, on the easy things that, in your medical billing world, you bill for something, you get reimbursed for something appropriately, because that's the name of the game. Those who understand the game understand how to make that game work in their favor, aka Walgreens, CVS. That's just how it's played, and that's totally okay. However, right, where does that affect us is that we don't have as many independents that go in. You have more pharmacists than you've ever had, and you don't have any people that have the stomach to go and do an independent. Give me a break. And they've made it that way on purpose. And, again, I hope that changes. I really, really do. And, showing you guys here in New Mexico, there's still so much opportunity, so much, meat on the bone, and all of that. Again, it does take skill. It does take, a lot of things, but as we discuss it, right, it's not what it's just seemingly caked up to be. And, that's the demise of the pharmacy industry is the pharmacy industry itself. The top players in the game of capitalism have started to come to eat themselves. And that's where I think the momentum is attainable. And that's where it's exciting to see how that, is going to shape up for, the future of retail pharmacy as we continue to discuss it, for sure. And agreed, Marcy, thank you. Yes, we are losing the human touch in this world. The pharmacist is the most important person to be available in the community. I completely agree. A pharmacist that is got 3 people that have some really important questions for them, but has to, sit back behind a computer stuck so bad that they can't even move because there's so much work to be done that you can't answer a simple question. That's something wrong in this world. And corporations that have managed to create those sort of situations, cough, cough, Walgreens, CVS, geez, guys, we are going to get better than that someday, for sure. So looking at this study, guys, just so everybody sees exactly kind of what we're talking about, the opportunities, because where there is problems, there are opportunities. The assessment of pharmacy closures in the United States from 2009 to 15. Looking here, I thought the important part of the article for you guys, dropping it down to the discussion, despite the growing number of pharmacies in the United States, findings from the study indicate that 1 in 8 pharmacies had closed between 2009 and 2015, which disproportionately affected independent pharmacies and low-income neighborhoods. Although efforts to promote pharmacy access have focused on addressing pharmacy closures in rural areas, we found that pharmacies located in low-income urban areas are at greater risk of closing. These findings suggest that policies aimed at reducing pharmacy closures should consider payment reforms, including increases in pharmacy reimbursement rates for Medicaid and Medicare prescriptions. Findings also suggest the importance of understanding the influence of preferred pharmacy networks in order to protect independent pharmacies more at risk for closure, especially in urban areas. Such efforts are important because pharmacy closures are associated with non-adherence to prescription medications, and declines in adherence are worse in patients using independent pharmacies that subsequently closed. See that right there? Health outcomes get torched. And there's nothing to be done about that as CVS and Walgreens close all their stores, reap everybody from the top and the bottom for every dollar that they can, their patients, every pharmacy in their network, and the government. And literally, who's suffering? Everybody but them. And that's what, ultimately it comes down to. And those are the reforms that can happen someday. And that's truly what we believe. So New Mexico, we have been dialed into a heck of a situation. Granted, maybe the city of Albuquerque by ratio has probably, decent amount of pharmacies per people. Las Cruces, guys, we already know. But that's all the exciting stuff I want to share with you there. Anyways, moving on to our Herbal Wellness Corner, brought to you by High Horse Cannabis Company. Check this out. Earlier today, got to take my white coat off, hang out, and do a podcast with our High Horse crew over there as the director of training at High Horse Cannabis Company. Guys, it's very important to me to, continue that conversation, cannabis advocacy, so on and so forth. And, me, Bennett, and our director of manufacturing, Omar, had a great time talking about hash holes. We actually even, partook a little bit. So it's fun, but at the same time, informational, insightful, and, maybe not for your medical crowd per se, but I hope everybody does get a chance to, watch our full spectrum podcast from High Horse Cannabis, because It's a really good platform for us to singularity talk about cannabis. And again, most platforms don't allow you to do so freely. That's why I barely have a 10-minute segment called the Herbal Wellness Corner. Anyways, moving on, guys. Community Spotlight today, spotlighting the Oregon Mountain Boys Basketball second annual cornhole tournament at Amador Live next Wednesday, October 25th, week from today. Cash prize is $400 to the first, $100 to the second, $50 to the third. Registration $530. Bags fly at 6. Boom, boom, boom. Hope everybody sees all those deets there. Support your local basketball teams. Last things here, guys. Showing you another interesting study that I found in our Men's Health Minute, talking about barbershops as a setting for supporting men's health during the COVID-19 pandemic. So, this study came out of the UK, but again, October is Mental Health Awareness Month. In our Men's Health Minute, I think this is a great one where you look at places where men do congregate and spend, a decent amount of their time with people that they trust, right? So where can you capitalize on that? I love it. Theme analysis, overarching themes, to really have some possible success. They're more than a haircut, right? More than a haircut can help, perhaps really create some barber-client relationships, which thus, men even just expressing themselves and talking is a mental health strategy there, right? For men that, it's not necessarily the man's strongest, genetic trait there of communicating with one's emotions and feelings. And, most humans have hard times with that. And with the amount of stimulation that we have from every waking corner of the earth, it makes it that much harder. But, think about a time when you're not going to be on your phone, where you have to give somebody a one-on-one attention. And you get to just spend some time with somebody else in a usually trusted situation where you're like, able to sit down, relax, and let loose and look good, feel good, right? So barbershops, I love it. I love the idea of barbershops, promoting men's health, promoting, right, more than a haircut and what that could actually mean for people. So for those of you who goes to the barbershop, take that as a testament and a nod to the fact that you're doing a little something for yourself on top of, just buzzing the head. Cool. Anyways, anybody else has any other questions, please feel free to drop them in the comments. Marcy, thank you for chit-chatting. Other than that, guys, this is the end of our hump day special. See you laters.